Hello, good afternoon. COVID-19 has created a global crisis, one that is affecting millions of children around the world. As the Chief Program Officer at Right to Play, I led the implementation of a rapid and thoughtful response to the pandemic for the 2.4 million children we serve each year in 14 countries in Africa, Asia, and the Middle East. At Right to Play, we have always believed in the power of play-based learning to transform children's lives. This continues to be true, especially during this current health crisis, where children's lives have been disrupted. We believe that play saves lives, be it in the form of providing psychosocial support for children or reducing gender-based violence for girls. According to UNESCO, by April 2020, global school closures had forced 91% of the world's student population to be out of school. Children are at risk of not returning to school due to child labor, child marriage, negative psychosocial impacts such as trauma, sadness, depression, and social isolation, or violence at home. Let me speak briefly about the stages of the evolved crisis. At stage 1, we are continuing to support learning for children and youth through play-based activities. We are using child-friendly distant education methods to deliver life skills games for specific learnings and outcomes. We work with teachers, coaches, and parents to reach and accompany children meaningfully at home. Stage 2, this phase includes transitions for children, their families and teachers going back to school, as well as immediately putting new creative and innovative ideas into practice to building back better. Teaching methods in classrooms may change in the future, and non-formal and informal learning, as well as parental support for formal learning at home, may become more important. These steps, while keeping the momentum, should result in approaches and systems with a renewed and improved vision, allowing us to be better prepared for the future because of the progress we've made in implementing new approaches and because of the readiness and flexibility of systems and stakeholders. Presently, we are between phases 2 and 3 overall. Right to Play's immediate and longer-term response to the COVID-19 crisis focuses on delivering health and psychosocial support activities remotely to children and parents. We adapted our existing frameworks for distressed children in contexts of vulnerability towards activities for skills building as shown on our screen. Here we can see how we translated this framework into practice, a game around staying healthy and washing hands. Beyond this crisis, children in the 21st century will need to develop towards constantly reinventing themselves in a fast-changing environment, be agents of their own and the surrounding change, and remain creative for a peaceful and productive society. An example is being seen on the slide. This framework was made available to all country teams and partners, and step-by-step guidance for contextualized game development is described in this one-pager. The games combine guidance from scientific institutions with a playful approach to foster subject knowledge and social-emotional skills building in and out of school. For successful implementations, Right to Play always builds on partnerships by providing technical assistance to government and international cooperation partners for integrating playful learning into distance learning and by making our Play at Home resource available to partners around the globe. Our program activities focus on capacity building to integrate play-based learning into regular and sustainable teaching practices, plans, and policies. Advocacy and social mobilization, including parents and communities, and service provision, including distribution of materials. The present crisis has allowed us to serve more than 10 million children by using radio, television, and internet applications like e-learning. In Mozambique, for example, the Ministry of Education integrated playful learning in their nationally broadcasted TV lessons, reaching 1.2 million children. We supported the ministry in designing and follow up through WhatsApp and awareness raising so that children don't miss the lessons. In Lebanon, we supported the Sat7 network in broadcasting Puzzle TV, a play-based learning show reaching over 1 million children in Lebanon and about 5 million in the region overall. In Mali, we reached over 700,000 children and 950,000 adults through community-based radio program with messaging on child protection that can be implemented in a playful manner. In Ghana and Uganda, model playful learning radio lesson plans were jointly prepared with the Ministry of Education for continued formal learning during crisis. In Palestine, platforms and e-learning applications with and for coaches and mentors for improved social-emotional skills development are reaching more than 50,000 children. In Jordan, physical activity videos developed by Right to Play are broadcasted on the Ministry of Education's national distance learning channels, reaching 1.4 million children. In Tanzania, over 2.2 million children are reached through radio drama on education and gender equality broadcast by Radio Free Africa. So what's next? How can we make sure we don't lose the efforts and progress made? Right to Play is and remains an active member of the Tanzania Ending Child Marriage Network. As a result of the network effort, the Tanzania Law of Marriage Act of 1971, which allows a girl child to be married off before the age of 18 years, was amended in September 2019. We will continue to use radio to complement efforts to educate, protect, and empower children. The proven advantage is the wide and cost-effective outreach. A broadcast reaches 4.9 million people at a cost of $260 and reaches more remote and disadvantaged areas of the country. With regards to new technologies, Audiopedia is an easy-to-use structured audiobook that can be navigated by illiterate users. Finally, our team, together with government education officials, have modified the teacher network's mandate to now include supporting home learning and health initiatives for children in their neighborhoods. For example, teachers have developed learning materials which were distributed to parents through the schools. Teachers are also using Right to Play games to teach children appropriate hand washing practice. Thank you for your attention.